It's an endocrinologist-owned and operated diabetes management company. You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Dr. Suzanne Clough, founder and chief medical officer of WellDoc Communications, located in Baltimore, Maryland. Dr. Clough, welcome to the Clinicians Roundtable.
Thanks for having me, Susan.
Tell us about WellDoc Communications.
Well, WellDoc Communications, we're a technology-based healthcare company whose current focus is really improving diabetes management, both from a patient outcome and lifestyle perspective, but also in reducing healthcare costs of diabetes. We also think that our application is applicable for wellness and prevention programs, though, as I mentioned before, currently the focus of WellDoc is type 2 diabetes.
How did the company get started?
Well, I'm an adult endocrinologist, and I'm one of the company's founders. And while I was practicing endocrinology, I was just getting very frustrated with the way diabetes outcomes were happening in our country. And I realized it was almost like trying to teach patients a foreign language in a 15-minute office visit. It's a very complicated disease. And I had several aha moments, but one of them was that just about everybody, regardless of socioeconomic status, who walked into our office had a cell phone. And a couple of us sort of put our heads together and said, there's got to be a way we can leverage that ubiquitous technology to be able to help patients, support them, coach them out in the real world with their disease. And so we've actually leveraged the cell phone and the internet to provide this diabetes management software to patients.
What led to your interest in diabetes?
I've always been a firm believer that the healthcare system today is way too focused on acute care, on acute sick care, actually. And with diabetes, one of the things that I found most fascinating is here's a disease we can really modify with lifestyle management. If I could just help my patients eat better, move better, feel better, then the outcomes of the disease tend to be better.
Describe the variety of products and services that WellDoc offers.
What we really do with people with diabetes is provide them with a personalized approach. One of the big themes at WellDoc is every disease is different based on the individual. So we take a patient's physician's instructions. We learn a little bit about the patient, their lifestyle, where they are in the behavior change model, sort of their belief system. And through that, we deliver to them an education platform to their cell phone and the web that really sort of works with them as an individual. So the software not only focuses on the medication compliance piece of the disease, but also on the wellness, fitness, nutrition component of the disease.
How does the technology work?
The first thing to mention is that when we started WellDoc, we said this technology has got to be simple, and it has to be used even for the most naive patient to technology. So it starts off where we actually push an SMS, a text message, over the air to a patient's cell phone. And that's it as far as text messaging. This is not a text messaging application. But when the patient sees that link on their cell phone, they can click a button and the application downloads. And prior to that, we'll have registered the patient on the internet. And by registering, I mean we just collect some really pertinent data to their disease. What is their doctor's medical instructions? How often do they exercise? Where would they like the most help, whether it's nutrition or exercise? And from there, we sort of delivered this personalized cell phone application. So on the cell phone, there's a very small layer of software that even if the patient's out of network coverage, they can still operate this little coaching piece. And the coaching piece on the software helps the patient troubleshoot every single blood sugar they test. So it sort of gives them acute feedback right at that time. We also follow a patient longitudinally and track their blood sugars so that if we start to see a pattern, we can actually push messages to the cell phone and to the patient's website and say, hey, you know what? This isn't probably just an isolated, quote-unquote, bad blood sugar. This is actually part of a bigger problem. Let's investigate a little bit more. And if we can find a medication error, or even if we don't find the cause, we will push to the physician because the physician also has a website, a quick message that says, hey, we've picked up an issue either with your patient's blood sugars or your patient's medication regimen we think you should be aware of. So really the two main pieces of the WellDoc solution is the cell phone and the web. And I do want to point out, as a physician, the one thing we really wanted to stress with this software is not to bombard physicians with alerts and blood glucose and letters, because we have too much to do as it is. So we've really designed this to try to work around the physician's normal workflow and only push them extra data if we feel there is something that's potentially harmful to the patient.
Is this initiated by the patient's physician? They would introduce it to their patients?
We're in clinical trials right now, so the way this has worked is that we, through a research study, have gone to physicians and said, would you like to participate? Can we recruit your patients? So it has been sort of a physician-initiated. Our ultimate business model is this is something that will be offered by disease management companies, by health insurance companies, so that physicians can opt in if they choose, and patients essentially can opt in if they choose, is the current disease management model. But we've found that this solution works best when all of the stakeholders are included, that being the patient, if they have a caregiver, and the physician. So when all the parties sort of opt in to participate, that's really when the WellDoc solution is the most efficacious.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Susan Dolan, your host, and with me is Dr. Suzanne Clough, discussing her technology-based healthcare company, WellDoc Communications. Dr. Clough, what feedback are you receiving from doctors?
The doctors actually have been wonderful. In our first pilot study that had about 7 docs involved, we had 100% satisfaction with the system. Currently, we have about 40 doctors enrolled in our next larger trial, and we're getting the same feedback. And this positive feedback is stemming from a couple of things. One, doctors have said, listen, we previously have often never even received data from our patients. When it comes to blood glucose meters or blood glucose logs, we've been lacking that data. Secondly, when we have gotten that data, it's almost impossible by the naked eye to decipher if there's any patterns there. It tends to be a jumbled bunch of numbers, so they appreciate the fact that we're actually giving them an organized, analyzed logbook. And then the last piece that we're hearing is that they appreciate the fact that we're not sending them blood glucose after blood glucose, that we're really trying to tie it in with the patient's office visits, so that this is something that they can incorporate into their normal workflow rather than feeling like it's one more thing that primary care doctors are being asked to do.
What feedback are you receiving from the patients?
The patient feedback has been really wonderful. What we're hearing from the patients is that it's the first time they're really able to understand their disease in context of their own life. We often hear, I went to see my doctor or some sort of healthcare provider, and they gave me a book on diabetes. And they said half the time I didn't even know what chapter to look in. I didn't even know I was having a problem. And they said that the WellDoc system really helped bring to light, what the issues are for them. More importantly, people with type 2 diabetes who are not on insulin, we're finding that people are saying, for the first time in my life, I understand how food is affecting my disease and how I can actually use food to affect the outcomes of my disease. A couple of the patients in the current trial are worried when the trial ends that, their life won't be the same because they need to have that phone. They need to have sort of big brother watching and that coaching support. So we've been very, very pleased about the feedback from the patients.
Give us an example of how the coaching piece works.
Let's say it's breakfast time and a patient wakes up and decides it's time to test her blood sugar. She enters her sugar and it's 60, which is low. We encourage people with a blood sugar of less than 70 oftentimes to treat that with some sort of sugar intake, carbohydrate intake. So the first thing the system does is says, time out, and calls the patient by her first name. Let's call her Jane. Time out, Jane. Your sugar's low here. Before you eat breakfast, let's make sure you fix that sugar. And a couple of points there is that a lot of people think they can just go ahead and eat whatever they want and their blood sugar will be fixed. not understanding what's the difference between a carbohydrate, a fat, or a protein. So if you're eating an all-protein breakfast, they're not going to fix that low sugar. So we teach even at that point. And then the next important thing is people should retest their blood sugar in 15 minutes to make sure that the low blood sugar has been corrected. We found from watching patients over and over, we've seen a couple of patterns. One, they test too quick because they feel bad. The number's still low because the carbohydrates haven't had time to take effect, and they keep eating more. And so you get this vicious cycle of hypo versus hyper. So we try to provide a little bit of peace of mind to the patient, saying, look, we're going to set a reminder on the phone for 15 minutes. So when you eat, go ahead and push the button. The clock will count down. And even if you turn your phone off, we're going to turn it on and say, hey, it's been 15 minutes, time to retest. The one great thing about the phone is that you can use the multimedia capabilities of a phone. So if people don't know what to eat, we actually present them with pictures of the different foods and the portions that they should be eating. So this coach not only helps sort of the critical numbers, the very high or the very low, but it also helps sort of with the everyday maintenance of diabetes. One thing we found, especially with people on insulin, is they often forget what the dose is supposed to be based on the time of day or based on the blood sugar. And we program in what their physician has prescribed, so when they test and it's at a certain time, it's a certain value, up pops their physician's instructions. So it sort of takes the guesswork and some of the stress out of diabetes.
How can doctors learn more about the technology?
Well, the first thing they can do is just go to our website, which is www.WellDoc-Communications.com. And there they can see a product demonstration.
Dr. Clough, what's your take-home message?
I would just say that physicians and patients alike have to remember that diabetes is a very, very complex condition, and that if we can provide a system for them to really simplify the diabetes management and take the guesswork out of diabetes management, both by sort of leveraging technology and by providing the emotional support, I think that we can really start to make a dent in this disease. And when our team created WellDoc, the goal was to make this an easier disease for both healthcare providers and for patients.
Dr. Clough, thank you so much for joining us to discuss WellDoc Communications.
Thank you, Susan, for having me.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. Please visit our website at reachmd.com, which now features our entire library of on-demand podcasts, or call us toll-free with your comments and suggestions at 888-MD XM 157. Thank you for listening.